Hey everyone, welcome back to Channel, where we take the mystery out of medicine and turn complex science into empowering health choices. Today's spotlight is on Prolia, also known by its scientific name, Denosumab. This review is being done by a board-certified rheumatologist. If you or someone you love has been dealing with osteoporosis or bone loss, this video is for you. Before we dive in, a quick but important note. This video is for education and inspiration only, not medical advice. Always consult a licensed healthcare professional before making treatment decisions. Let's get started. Prolia is an FDA-approved prescription medication used to treat osteoporosis, especially in postmenopausal women at high risk for fractures. It's also used to increase bone mass in men with osteoporosis and for bone loss associated with certain cancer treatments. Think of your bones like a construction site. Some cells build and others tear down. Prolia blocks a protein called rankle, which is needed to activate the cells that break down bone, osteoclasts. By stopping that demolition crew, Prolia helps your body keep and even rebuild bone mass. Here's one of the reasons people love Prolia. It's convenient. It's given as a subcutaneous injection once every 6 months. No daily pills, no complicated routines. Just remember, calcium and vitamin D are your bone buddies. Make sure you're getting enough of both during treatment. All right, let's talk results. And they're impressive. In the large Freedom trial, women taking Prolia for 3 years had 9.2% increase in bone mineral density BMD at the lumbar spine, 16% increase at the total hip compared to placebo. And it doesn't stop there. In a long-term follow-up study, patients who continued Prolia for 10 years showed a 20.7% increase in BMD at the lumbar spine, 9.2% increase at the total hip. Yes, you heard that right. 10 years, and it keeps working. Unlike bisphosphonates, where effectiveness can taper off or require a break due to long-term skeletal fatigue, Prolia continues building bone strength year after year. Great question. Both are solid choices, but here's why some people choose Prolia over bisphosphonates like Fosamax or Reclast. 1. Gut-friendly. Bisphosphonates are taken orally and can irritate your esophagus or stomach. Prolia, no GI issues, just a twice-a-year shot. 2. Easier compliance. Let's face it, remembering a weekly or monthly pill isn't for everyone. With Prolia, it's one quick injection every 6 months. 3. Jawbone safety. Both classes carry a rare risk of osteonecrosis of the jaw, ONJ, but evidence suggests that long-term ONJ risk may actually be lower with Prolia, especially after the 2-year mark. 4. T-score thresholds. Prolia is usually started when a T-score is -2.5 or lower, or if you've had a fragility fracture. It's also ideal if you're at high fracture risk or can't tolerate bisphosphonates. Let's be real, every medication has risks. With Prolia, some of the most common side effects include muscle or joint pain, back pain, high cholesterol levels, skin reactions like eczema or rash. More serious but rare risks include low calcium, especially if you're not supplementing properly, infections, particularly of the urinary or respiratory tract, osteonecrosis of the jaw, as mentioned, atypical femur fractures, again extremely rare. So what do patients say? Many report feeling stronger, fewer fractures, and better bone scan results year after year. Some people feel achy after the injection, but it's often manageable. If you're considering Prolia, it's important to monitor labs, stay on track with injections, and let your doctor know about any dental work you're planning. Prolia isn't for everyone. You shouldn't start if you have low blood calcium hypocalcemia that hasn't been corrected, you're allergic to Denosumab, you're planning extensive dental surgery without prior consultation. Also, you'll want to review any medications that affect your immune system, as Prolia may slightly increase infection risk. Not sold on Prolia? That's okay, there are other options. Bisphosphonates like alendronate or zoledronic acid, anabolics like teriparatide for Teo or romosozumab Evenity, hormone therapy for select patients. Each comes with pros and cons, and your doctor can help tailor a plan to your bone density, fracture history, and lifestyle. Here's the bottom line. Prolia is powerful, proven, and easy to use. It continues to build bone strength for a full decade, with results you can see on your DEXA scan. For people at high fracture risk or who've had trouble with other medications, Prolia could be a game changer. But as always, it's not a one-size-fits-all solution. Talk to your doctor, weigh the risks and benefits, and make the decision that keeps you standing tall and strong. If you found this video helpful, give us a thumbs up, share it with someone who needs it, and don't forget to subscribe for more empowering health content. We've got more deep dives on osteoporosis treatments coming soon, so stay tuned.